Breast lift techniques. The techniques vary depending on each patient's profile and goals. As a rule, the techniques with the most number of incisions allow for the greatest change in shape, while fewer incisions provide for less modification. This means that there is a trade-off in potential scars for change in overall shape. A surgeon will know what will work best for each patient and will be able to discuss each technique in detail during consultation. The following are the most standard techniques. The inverted T or anchor technique. This is the most common breast lift procedure used today. The reason behind its popularity is the shape of the incisions made during surgery. This shape follows the natural contours of the breast and usually reduces the size of the areola in the process. Incisions are made in 3 places: around the areola, along the contour beneath the breast, between the areola and the base of the breast. The traditional technique uses more and larger incisions as compared to the modified techniques. However, it maximizes the amount of change that can be applied to the breast. It is also used most often because it consistently produces the most desirable results. The doughnut technique. Also known as the Benelli breast lift, this is another form of modified breast lift that is typically performed on women with smaller breasts. The technique actually derived its name from the shape of the skin removed. The surgeon excises a ring of skin from around the areola, a procedure that is technically known as concentric mastopexy. It involves the use of fewer incisions, although this allows for less change to the shape of the breasts. Hence, a doughnut lift is best used when only less change in shape is needed. Crescent breast lift. This is a modified version of the doughnut technique. A ring of tissue is also removed from around the areola. However, more tissue is removed from above the areola than from below, hence the crescent name. This technique allows the surgeon to elevate the nipple and areola, and just like in a doughnut lift, the incisions and scarring are less than the traditional procedure. However, the amount of change that can be achieved is likewise limited. Lollipop or keyhole breast lift. This is another modified lifting technique similar to the doughnut lift. A keyhole incision produces a lollipop scar, hence the name. A ring of tissue is removed from around the nipple and the areola. The difference is that a vertical incision is made that runs to the crease under the breast. The resulting shape gives this technique its name, and just like other modified breast lift techniques, it limits the amount of change that can be made to the shape of the breasts. An advantage is that it also limits the number and shape of visible incision lines. Click Next to learn more about the costs of a breast lift.